Dr. Bizrah, why is there such a massive buzz around your facelift technique? How does your facelift technique differentiate amongst other surgeons?
We reach almost 90% of the deep vein technique. So most surgeons actually, this is, we say this is the muscle. The red one is the muscle of their face. They make a small cut here only. A small cut in this area, they make small cut in this area, small cut there, and they go for about a few centimeters, 2 centimeters under the muscle there, and they pull this muscle only and remove maybe about a strip of 1 centimeter, and then they suture after they do this, after they pull this muscle, they suture edge to edge. And this will give, it will pull this muscle, it will pull this muscle, it will pull this muscle, but it will pull it very partially. And will give actually it may give immediate good results.
But is it temporary?
After maybe 9 months or 1 year, the patient will be, will be the same, or only improvement by 20 to 30% maximum. That's really done by almost 99% of the patients.
So it's kind of like a temporary result, and the gravity pull probably.
We do actually the facelift on the first thing that we do on two floors or 2 stories. So we have the face and we have the face 1 and we have the neck 2. So we do the smash on 2 levels, the face and the neck. So what we do actually on the face first, start with the face. Our incision start not from the back, start from this area. We enter the muscle from this area, and we go under the muscle and under the skin, not under the skin, under the muscle and under the skin until we reach the corner of the nose, we reach the corner of the mouth and down to the chin there. So all this area here, we go under the muscle as you see there, under the skin and the muscle, under the muscle mainly, and reach the nose, the corner of the mouth, and the
That's quite
chin.
deep.
And the other very important thing that there are, God made here, five ligaments. There is 1 ligament there, and there is 1 ligament here, 1 ligament there, 1 ligament there, and 1 ligament there. Those ligaments should be divided, because I say with the 99% of the surgeons, they don't reach this ligament, and they don't divide this ligament. So those ligaments fix the muscle to the under structure, to the bone. So if you don't divide this ligament, you cannot pull enough. You cannot get a free lifting or free pulling of the muscle. So it's very important to release all these ligaments, the 5 ligaments, in order to move this muscle here, move this muscle freely, and achieve adequate lift of the cheek and the corner of the mouth and the chin, and therefore you can solve out the nasolabial line, the marionette line, and the corner of the mouth will go north also slightly. So it's very important that you go under the muscle and divide all these ligaments there. Very important. That's why I said, and most surgeons, they stay there in this area, they don't reach the front. That's really a major difference between us and the other surgeons. From the second point, the second big difference between my technique that also we have done now the face. We do a second smash in the neck. So we have 2 smash. One smash in the face, the second smash in the neck. So what we do in the neck, again, we got this muscle here. You can see this muscle, long muscle called sternocleidomastoid muscle. We go along the anterior edge of this muscle in this area here, and then we go under the platysma muscle, all the way through under the muscle to the midline, all under this platysma muscle to the midline. So under the muscle, and then we pull the muscle, and when you pull the muscle, you have some extra muscle here, there. So we go and divide and remove this extra muscle from there. So once we have removed this extra muscle from there, we go back and suture. When we remove this extra muscle, and suture the edge of the muscle to this sternocleidomastoid muscle. So the extra muscle removed, and then this muscle is pulled and sutured to this area. And this again will
give you get immediate lift here.
The maximum it will give the maximum lift there to this area. So that's why, and with this technique, with doing the face mask, tooth mask, the face and the neck mask, we obtain the best results. The best results, as you see now in the coming case. Another thing which distinguishes actually our technique from other technique, that during surgery we use something called facial nerve monitoring.
Okay.
Because many patients, they came to me with stories, say, okay, my friend had facelift somewhere else and she ended with weak face.
Yeah, they're quite common.
This lasted for a long time. I'm afraid I don't like the surgery anyway. In our hands now, with our application of this equipment, this machine, is very safe, and patient should not really get any weakness in the face after surgery. What this machine do? This machine works the same principle, the same like the
ECG.
heart ECG.
Yeah.
You put electrode here, and you can see the diagram, the graphic lines on the monitor.
Yeah.
So the same principle. We put this monitor, as you see, electrode on the face to cover all the facial nerve branches. So the facial nerve has got 4 branches in the face, 1 branch, 2nd branch, 3rd branch, and 4th branch. At the end of the branch, we put this electrode, as you see, this one electrode,
yeah.
1 electrode, 2, 1, 2, 3, and 4. And all these electrodes are connected to this machine, as you see. And each electrode will give you a diagram there, or graphic line for each electrode. So if, for example, for me as a surgeon, during surgery, I get close to the nerve, straight, as you see the beak here,
yeah.
the graphic line will start to beak like this, and also the machine will beep straight away to give me a warning beep.
So alerts you when there's a danger zone.
I'm close to the nerve, so I have to stay away. And this has 2 advantages. First of all, the safety, and secondly, that gives the surgeon the ability and the confidence to go further forward. So the more I go anterior there until the muscle, the more lift I can obtain, I can achieve. This is quite logic.
Yeah, of course. Yeah.
So the presence of such machine, the safety, and plus the confidence for the surgeon to go further under the face,
and better results,
to reach the nose, to reach the corner of the mouth, to reach the chin safely, and then pull the muscle in a nice way. Again, what happened in the neck. So you see now the great result really obtained using such technique, the great result between before and after. Is the great result on the cheek, on the margin of the mandible, on the neck, and you see this great result. Which technique will give you such really great result? It looks like her daughter actually. And this patient, they look like mother and daughter, not the same patient. And even the patient told me, they told her daughter, not herself. You see this great result, that the nasolabial line disappeared, manular line disappeared, the corner of the mouth is normal position. You see at the neck, look at this great improvement.
It's completely different face, honestly.
Yeah, this really magic, this great technique in the changes in the neck. So that's really the advantage of our technique. That's why our technique is distinguished from other technique. And only around 40 surgeons in the whole world who really can apply this technique, and they charge very, very expensive. Around $50,000, but our fees are very, very reasonable. So I hope this video was quite useful, and thank you for giving me the chance to explain.
You're most welcome. Thank you for showing this outstanding result. Honestly, you transformed her life completely, and she looks like her daughter or even younger, depending on how old her daughter is.
I mean, this patient, she said to me, I'm going to get you my mother. Her mother is about 80. He said, this lady, this English lady, she lives in Dubai. He said, my mother is coming for a visit, and she'll bring her mother for me.
You're transforming generations now.
Thank you very much.
Thank you so much for your time.
Thank you.